Welcome to the third section of ophthalmology, ulcers and abrasions. In the next 10 minutes, you'll have a review on eye anatomy essentials in relation to ulcers. You'll have a short checklist for common causes of ulcers. We'll go through some lingo. Is it simple, indolent, or complex? We'll talk about whether this needs to be referred and some therapeutic principles for ulcers. A quick review of anatomy, an obvious but important fact. The cornea forms the outermost layer of the eye, and for this reason it is prone to scrapes and tears. Take a minute to think about eye shape and exposure of the cornea in different breeds. Did either of these two breeds come to mind? There are definitely different breeds that are more prone to ocular concerns based on the shape of the face and how their eyes are exposed. The corneal layers have a story to tell. The cornea is made up of 5 layers of highly specialized skin cells. The corneal epithelium is the outermost layer, followed by the Bowman's membrane. The corneal stroma is the thickest layer. The thin Descemet's membrane lies on top of the single layer of the corneal endothelium. Depending on the corneal layers involved, treatment and prognosis changes. The most common cause of acutely painful red eyes is a corneal abrasion. This is also called a simple ulcer. They are expected to heal in about 5 to 7 days. A corneal abrasion occurs upon erosion of a few of the layers of the epithelium. When a deeper erosion through the entire epithelium and into the stroma is detected, the result is called a complex corneal ulcer. These take longer to heal. Green fluorescein dye, an essential part of the eye exam, highlights the complex ulcer in this picture. The chronic ulcer story. An indolent ulcer is a superficial ulcer that has been present for more than 10 days and is not infected. They are noted in middle age and older dogs and have a typical appearance which includes loose epithelium around the ulcer edge. Some common breeds are boxers, golden retrievers, and corgis. New terminology refers to them as spontaneous chronic corneal epithelial defects. Now the story becomes urgent. If an ulcer is infected, initial 24-hour hospital care may be necessary to ensure adequate treatment and monitoring. Severe infection can cause the cornea to melt and the eye is at risk of rupture. If the ulcer is down to the Descemet's membrane, there is only one layer of cells present before the cornea ruptures. Melting ulcers and desmetocele require immediate referral to an ophthalmologist. Common causes of corneal abrasion include rough contact with plants, thorns, or bushes, scratches from another animal. Note, the cat scratch wound can be especially serious as the wound quickly heals over, sealing infection within the eye. Self-trauma, rubbing or scratching at a painful ear or even at the eye due to some other eye problem can lead to an inadvertent scratch to the eye. Chemical irritation, such as getting shampoo in the eye during a bath, or foreign body injury, plant material can get stuck under an eyelid and can scrape the cornea. Corneal ulceration in cats is different. Feline herpes virus is the cause of surface ocular disease in many cats. It is fair to consider herpes the cause until thorough examination suggests otherwise. The virus is actually capable of causing corneal ulceration by infecting and killing corneal epithelial cells. Eyelid, lash, or tear film abnormalities, trauma, neurologic deficiencies also apply to the cat. An exam is needed. Your ulcer treatment principles list. All eye problems should be seen quickly for an accurate assessment of the problem. Always look for an underlying cause that needs specific treatment. Therapy will need to be individualized to the patient and will depend on whether the ulcer is simple, indolent, or complex. Certain complex ulcers may need emergency referral. Preventing or treating infection with topical eye medication will be the mainstay of treatment, along with pain control measures. Provide structural support or facilitating healing when necessary. An indolent ulcer requires procedures that carefully physically manipulate the cornea, such as corneal debridement or possibly keratotomy. Certain complex ulcers may require additional diagnostics such as cytology, cultures, or referral surgery. Topical medication may be needed up to 12 times a day. Treatment step number 1, keep that eye safe. The first step is getting an e-collar on that patient to prevent any further scratching, rubbing, irritation, or trauma to that eye. If your patient is a cat with herpes virus, there are some adjunct treatments that can help keep herpes in clinical remission. Cats with herpes virus are susceptible to stress. Identifying triggers or stressors in the environment are an important part of maintaining clinical remission. L-lysine, 500 milligrams a day for an adult cat, can be considered as adjunct preventative therapy for cats in clinical remission from herpes. It is best to wait until after the patient has recovered before introducing diet changes. It is better to have the cat consume 500 milligrams in a single meal than grazing throughout the day. Feel away may be helpful in decreasing the incidence and severity of outbreaks. The nutrition basics are so important. Let's not forget that high quality nutrition and maintaining ideal body condition will be one of the best ways to help maintain a strong immune system. And a strong immune system is beneficial for maintaining herpes virus in clinical remission. In some special situations, a corneal shield may be an important part of treatment and management. iMed Animal Health offers Vet Shield. This 72-hour absorbable bovine collagen-based corneal shield can help with patients with eyelid or eyelash abnormalities that cause ongoing mechanical trauma and pain to a healing cornea. A collagen shield has also been shown to enhance epithelial healing response. As it dissolves, it provides lubrication. The Vet Shield allows water-based medications to pass through and reach the traumatized cornea. It is not permeable to ointments and oil-based solutions, and any infection must be treated prior to the use of Vet Shield. Are you the expert in the clinic about coaching clients to administer medication to their pets? Everyone on the veterinary team has a very important role to play in ensuring the success of these tricky cases. Owners will need support managing the e-collar as well as giving the medication. And given the importance of eye medications being given on time, these cases need daily check-ins, especially at the beginning of therapy. Schedule that recheck at the time of discharge to ensure that you are seeing the patient back within the critical time period. Your communication and management throughout the entire team will help ensure the owner has success at home. Thank you for joining us. Join us for more 10-minute takeaways where we provide you with these useful resources for everyday clinical situations. Next up is the most common eye-related problem for presentation to the veterinary team, conjunctivitis.